invest in both the public, private, and the philanthropic sector of our community, is everyone has talked about this institutionalized inequities, disparities, and racism. And there's and people are talking about it in a way that they recognize it now. There's no need to convince people of it, but there's a conversation of what do we do about it? How do we address this? And so what we will be doing is we will be introducing a piece of legislation to the City Council in the next council meeting. I think that's next Wednesday. And this legislation will create a new division in the Department of Public Health. And that division is a division that we will call Health, Equity, and Social Justice. So we will establish this division, and we will create a commissioner that will head up that division. And now, as you also know, that as we restructured the health department, and when we talked about that earlier, talked about it in a way that says we will be doing those traditional things, but we wanted to expand the mission of the health department to be in line with what needs to be not only identified as health issues, but how do we create an institutionalize an infrastructure that will allow us to have a systematic approach to do holistic kind of changes and interact with our community at large, whether it's the public sector, private, or philanthropic. And this division, and led by the commissioner of the division, will be responsible for that. So what I'll do now is introduce the director of human resources, who will give you like the job description of this thing, and then we'll have the chief of who will the department that reports to Chief Thompson. She will give you the general notion of the interaction between her other activities under her cluster, and then we'll have the interim director come up and talk to you about what's currently going on with COVID, and what are we doing now, and how are we faring as we move forward. As you know, the governor will be making his announcement later today, and we're looking forward to seeing whether or not we are moving to level 4 purple, or we're staying at level 3, which is red. In any case, our approach to this is to stay consistent and persistent in what we're doing, regardless of the level, because we always assume that we're at the worst level anyway. And so we want to act as if we're that way. And there may be some tweaks depending on what the governor comes out with today. But that's the game plan. Then we'll take questions from you. Hopefully, you keep them related to health today. And if we kind of redirect you and say that we'll deal with it another time, don't be offended by that. We're not avoiding it. But we want to really stay focused on health today, and not only in terms of the virus, but also in terms of our creating this new division with a new commissioner to institutionalize this infrastructure for this new mission side of health. So, Director.
Thank you, Mayor. As we stated, we're creating the Commissioner of Health Equity and Social Justice. This position is going to look at root causes. When we say root causes, we're talking about a person's ability to thrive and achieve their full potential. This is regardless of race, ethnicity, or social economic status. In addition, we're having this social justice component. Social justice serves as the lens through which we have to look whenever we're thinking about advancing a person's quality of life or their well-being. We're looking at the systemic challenges and those chronic conditions and impediments that prevent this growth. Improving health outcomes and the overall quality of life are the most important things as we look at our most disadvantaged populations. There's a couple definitions by which this position will have to continue operating. Those definitions include health and equity. We are defining health inequity as health equity is achieved when every person has the opportunity to attain their full health potential. No one is disadvantaged from achieving this full health potential or their social position, regardless of those circumstances. Social determinants. We're looking at social determinants as aspects of health that include social environment. A social environment can be something like discrimination, income, education. Physical environments include your place of residence. Your built environment includes building spaces or transportation. And then health services are the access to quality health. When we speak about social justice, we're talking about the idea that social justice is that all people have access to wealth, health, and well-being, justice, privileges, and opportunities regardless of their race, ethnicity, or any social economic factors. This commissioner will be in charge of researching, implementing, developing based upon best practice, based upon personal experiences in implementing these things, and working with a team to ensure that we are looking at taking action and implementing steps to improve quality of life for those individuals.
So thank you, Mayor. I'm Tracy Martin Thompson. I serve as the Chief of Prevention, Intervention, and Opportunity for Youth and Young Adults. So I just want to note and reiterate what Director West just noted about the fact that really the core function of this particular office is really about looking at the connection between health equity and those social determinants of health, and really beginning to examine specifically what are at the root causes of these issues. What is really preventing or precluding individuals from being able to attain the highest quality of life possible and being able to thrive? And really beginning to examine those issues, look at patterns, look at trends, look at what we're seeing, and specifically now figuring out what do we begin to do about that, developing programs, initiatives, looking at policy, et cetera, doing the things that are necessary in order to eliminate those barriers that are precluding individuals from being able to attain the highest quality of life possible. And so this connects really directly to the work that we already do in the Office of Prevention, Intervention, and Opportunity for Youth and Young Adults. If you recall, the mayor created this office in 2017 in response to concerns about violence and youth violence and the impact that it has on the overall development of our young people, our families, and the communities. But what we recognize is the fact that when we begin to examine violence and its impact, it really has a true health impact on the overall development of our youth. It can literally change the architecture of the brain. It can have direct impact on the overall physical development as well as the social emotional development of our young people and have a real huge impact on families overall. And so in response to that, one of the things that we've already done is we've been working on transforming our 22 rec centers into what we call trauma-informed care neighborhood resource and recreation centers. And we're doing this in an effort to respond to the needs of the community, to ensure that there's equitable access to resources and support services that individuals need in order to help them to overcome some of those barriers that are really getting in the way from them being able to reach success and thrive and live quality lives. And so again, all of this is connected together and a part of the mayor's larger vision to ensure that we create stronger individuals, stronger families, stronger neighborhoods, and ultimately a stronger city of Cleveland.
I'm Brian Kemple. I'm the interim director for the Cleveland Department of Public Health. I'm here to talk to you a little bit about COVID in today. We have over 6,000 new cases, or we have over 6,000 cases. We have been averaging close to 50 new cases a day over the last 7 days. That has almost doubled since over the past 3 weeks. This is concerning. So I want to discuss with you today exactly what steps are we continuing to take to help reduce the potential exposure to our community. I want to talk to you about our enforcement actions. We continue to do enforcement. We continue to take complaints and investigate those complaints. This weekend, we will be partnering with our public safety partners to be out in the community to enforce our local codes in restaurants and establishments like that. So we will be out there enforcing, making sure that we're in compliance with the face covering ordinance. We're in compliance with social distancing. We're in compliance with making sure that we're adhering to all the local and state regulations. In addition to that, we know that this is impacting the most vulnerable population in our community. And we're going to make sure that we're out there providing and increasing the opportunity for testing for COVID. So over the next month or so, you will see us and our partners out there providing COVID tests to help identify those individuals that have been exposed or believe that they have been exposed.
All right, so now we'll open it up for questions.
One question is from Jason Walker. He says, it sounds like a step in the right direction, but he asked, how will the commissioner be selected?
Well, the question is, statement is, it sounds like a move in the right direction, but how would the commission be selected? Through normal process, we'll post, and then we'll have, and with the minimum qualifications, the Director of Human Resources gave you some indications of what we're looking for, but there'll be some minimum qualifications that will be in that posting, and then it will be whittled down to a few people who will receive interviews, and then I will work with the director of interim director of health and the chief who's in charge of that department. And we will work together and we will pick who we believe to be the appropriate person. But there will be a posted job description, minimum qualification, and then there will be some interviews and brought down to a very narrow selection in which we'll work on that.
Okay, Mayor, the next question is from Rachel DeSalle. It's a two-part question. She states, I just want to put on the record that I've asked several questions about the deaths the city of Cleveland is reporting. The number has remained at 148 in the emails reported to the public from the city since early September, although the dashboard says 150.
All right, hold on. Let me take them once. You got two questions. All right, let's deal with the first question. The first question is, well, the first statement was they want to be on the record. I'm glad I'm on the record too. And so that being said, I guess there's some discrepancy in what we released and what the dashboard had posted, I think by two, and it's related to deaths. I think we released 148, and I think some other said 150 on some dashboard. So, Director, could you explain that?
So we have released the data that states we have 148 deaths. That is accurate. From time to time, we receive death reports that are not in our jurisdiction. So those have to be identified and moved from our records. So there was a discrepancy there. We've cleared that up, and our number is 148. I just want to explain a little bit about the process. So it's just not for us to receive that information as a confirmed death in the city of Cleveland. We have to do a little bit more research because we know this is sensitive information. We want to make sure that we get this information right and report it correctly. So we take our time. We do a little bit more research. We identify and verify the death certificate. We also follow up with medical providers to get additional information to confirm that this is a resident of the city of Cleveland.
Second question? It was a two-part question, you said.
I
What's
think
the
he
second?
covered it in his answer,
Well,
but the
what's the
second part
question?
was, if there is experience in delays in getting these numbers that we put out due to a short staffing in the health department, or is it an issue with the backlog of death certificates due to short staffing in vital statistics?
All right, so the question is, the assumption was that it was incorrect. We said it's correct, but I was also saying that is there our ability to handle reporting the death is a factor of shortage in staff in health or in vital statistics. And I'll let the director also address that.
So as I explained earlier, the process is tedious and we want to make sure we get this information correct. So for any COVID-related deaths, we do further investigation, research to verify and confirm, actually, this is a death related to COVID and is a resident of the city of Cleveland. This has absolutely nothing to do with our staffing at the health department. We are working to make sure we get the information right.
Okay, Mayor, we have two questions from Anna Huntsman with Ideas Group. I'll do the first question. Cuyahoga County is approaching a level 4 emergency through the state's public health advisory system, indicating severe exposure and spread. If the county would reach that level, meaning level 4, what is the health department's plan, and can we expect to see any new closures or health orders?
The question is, if the county is declared to be purple level 4, what is our plan moving forward, and do we anticipate any shutdowns as a result of that? And what we're looking at that very issue, what we're staying focused on right now is being consistent and persistent about what we're doing, because again, as I mentioned earlier, we operate and we as if we're at a level 4. We try to be that stringent about what we do, and that's why we have a very strong enforcement arm, particularly with establishments. I don't know going forward what new things we will do. We will evaluate that as we're moving forward, and if we are declared a level 4 today or in the near future, we'll determine whether or not we'll take any additional actions or we'll double down on whatever it is that we're doing. One thing that I will say is that looking at the data, and then the director can verify if this is correct or not, that a lot of the increase that is occurring is a result of smaller gatherings of people in indoor setting. Where it's like if you have a party, and now that people are going inside and they're not outside, and you have a small gathering of people, and it's beginning to transmit that way, is what I'm understanding. And the spike, I think around 60% or so of the new cases are between 20 and 50 years old. The majority of them probably in the lower age range. But I'll let the director talk about this too.
So we have, our data has shown that smaller gatherings are really the cause of the number of increases in COVID cases in the city of Cleveland. We know that it's been a long year for us, and people are tired of being inside and tired of want to socialize. So what I want to impress upon and challenge everyone today is to practice social distancing, to kind of change your behavior, how you fellowship and how you socialize with your friends and your family. Remember, just because they're family, they may live in a different household, you want to still remain 6 feet apart. You want to still wear your face covering. This will help reduce those number of cases that are identified coming from these small gatherings.
And I think you had the second
Yeah,
question.
her second question is really on that point. In August, Mayor Jackson said he was looking into a plan to enforce restrictions of mass gatherings in residential areas.
Mhm.
Has that plan, which he said was coming from the Public Safety and Public Health Department, ever come to fruition? And given that health officials say COVID-19 is surging from group social gatherings rather than businesses and schools, is there a plan to implement and enforce
Well,
restrictions?
there's about 4 or 5 questions, so let me take them one at a time. and then you can remind me of the ones I haven't answered. And let me start with the thing was that I made some announcement that we were going to enforce a mass gathering, and we have done that through public safety. Whenever there's was reporting in the summertime, where people were having these block parties or large gatherings at houses where things were spilling out into the street, we got complaints about it. We went there and we dealt with it. And usually it was through law enforcement. In most of those cases, people cooperated. Is that correct? That's correct. In most of those cases, people cooperated. So yes, we did do that, and we did work with people because our goal was not to use a hammer, but when we found something that was obvious in violation of not only our mandate, but the state requirements, then we did approach the people who were responsible for that, and we talked to them, and in most cases, they agreed. One of those things that we did to help prevent a mass gathering was to eliminate tailgating. And so before the Browns season started, we made it very clear that there would be no tailgating on public property at our parking lots or other parking lots and things where there were, and if that happened, we would go in and enforce that. And it's my understanding that people have been cooperative with that too. And the director says people have been cooperative in that area. Now, the second part of this multi-part question.
The second part was, given that the health officials are surging for group gatherings rather than businesses, is there a plan to implement and enforce these gatherings?
There's an interesting part, even though I've answered it, I think, but there's an interesting part to that question about, again, identifying, according to the tracing, I guess, the state is doing, and maybe even the county and us, is that with the businesses and schools that are open or in some virtual, combination of virtual and in person, that they don't see, they don't trace back to that. They trace back to these smaller gatherings that the director spoke to you about and the larger gatherings. The larger gatherings will go indoors, and that's where we'll have a problem, and that's why the director has said what he said. But the interesting thing is that what we're finding, according to tracing, is that in businesses and in those schools that are open in a combination of virtual and in person, that they don't trace back to that. And so as we're looking at going forward, and we're considering what actions to take if we wind up going purple, then we'll have to consider that basic fact that you mentioned. Now, I want to also point out something. Is there another part to this question? But I also want to point out something to you, is that there's no plexiglass around Cleveland. You know, no, we didn't build an infrastructure where you had to come in to Cleveland, you had to come in one way, and you get tested, asked a bunch of questions, and you get your temperature checked and stuff like that. That doesn't happen. This city is a wide open city, and is a wide open state, and as a result of that, much of our efforts that we enforce here may not be enforced in other places. And if you look at the state data and you look at the tracing that is being done by the state, they will tell you that the urban centers were doing quite fine, that we were doing well in terms of bringing down the number of new cases, and the hospitalizations were not as high, all these things, the figures were going down. But in those areas where people, for whatever reason, thought it was not appropriate to wear masks or keep social distancing or wash their hands often, primarily in rural areas, that is when the state began to move into the spike that they're in now. And that is spilled over into many of our urban centers in the state. So I just want to remind you that we don't have a plexiglass, and we don't have a one-way in. where everybody gets tested. This is a free-flowing city, a free-flowing economy, and so we're not separate from what is happening statewide. And there's been a significant spike in new infections, hospitalizations, and deaths statewide. And so we're not exempt from that. So we do our part to attempt to address what's happening in Cleveland, but there are these other forces and these other things that are going on that also affects all of our efforts also.
Okay, the next two questions is from Jason Walker, a media podcaster. His first question is, what is a small size gathering?
I don't know what a small size gathering, I guess small, I don't know if there's a legal definition of that. Is there, Director? Yes, go ahead.
So when we talk about small gatherings, we're talking about gatherings of less than 300. Those would be considered small gatherings. But I want to give a little bit more information around, because the previous question was around whether or not we were going to take additional or reduce the enforcement actions or requirements around in businesses because we're not seeing this huge numbers in those. Well, we're not seeing outbreaks in those. It's not to say we're not seeing any cases. We're still seeing cases in restaurants and other businesses. It's just that we're not seeing two or more multiple cases that we're considering outbreaks. We're seeing more outbreaks coming from things like weddings, funerals, family reunions. Those are the areas in which we have been identifying outbreaks, and the numbers continue to increase.
Okay.
And to add to that, as part of the legislation that the city council passed, we incorporated in that if it's an establishment that where you have had a trace back where there's an infection in that establishment, that they are required to sanitize their establishment or face closure. And so that is part of what we do also.
But then the next question, same person, is how should we handle Halloween events or trick-or-treating?
The question is how to handle Halloween and trick-or-treat. Let me just say that what we're doing as a city, you know, every year Halloween we had Big City Boo, and that's all the rec centers were open, and they had Halloween parties, and people came dressed up. Some of them had haunted houses that they set up inside the rec center, you know, depending on the rec center. But it was literally, you know, several thousand kids would be participating. That is not happening this year with us at our rec centers. What we intend to do, and what we're going to do, is the day before Halloween is do the same thing we did when we distributed the free lunch program. You have kids come up with their parents or without their parents. They come up, and there will be items on I guess a table, and then they are socially distanced in a line, and they can come in and just pick up these items. Our intent is to have that done outside. I guess if it's raining, I don't know what the plan B is if it's raining, but our intent is to have that done outside. So we won't have the party, the thousands of kids. What we'll have is the availability of them to come by, pick up an item, and then move on and keep them socially distanced. And what was the second part of that? Oh, in terms of the Halloween itself, we have not, as a city, canceled Halloween. We have not done that. But the governor and the state have set some pretty clear guidelines as to what they suggest that people do. And that's what we get out. We will be getting that out to on our social media and other places, and we'll maybe send that the state guidelines to you so that you can have them and then communicate that out to the public as to how they would suggest that people conduct themselves during Halloween.
The next question comes from Olivia Mitchell,
Mhm.
a reporter from Cleveland.com and the Plain Dealer. Her statement is, at the governor's briefing on Tuesday, he insisted his new game plan will consist of mayors and officials at the local level to handle the coronavirus on their own. I was hoping to get your opinion on this and ask a few questions.
Well, ask your question because, I'm not, the governor has done a pretty good job, in terms of working with local communities, and mayors, in this situation. As the economy and things began to gradually reopen, those challenges became even more difficult. But you're right, in his communications, he has pretty much said that, that he is looking to local communities to develop their own approach to fighting the spikes in their community. That would probably be better dealt with if we had a broader guideline and directive. But you could say the same thing from the federal government, who punted to the state. And now the state is saying, in effect, that we're going through a spike, and we want local communities to see what they can do to get a hold of this and to take responsibility of trying to drive down those spikes in the local community. Having some broad guidelines in addition to what we already have would be helpful. I know that other mayors, in my conversation with them and the governor, have talked about things that they would like to see as some guidelines to help us to be able to do things on a local level. And I know that we're still in those conversations, and he's been very good at working with us to understand what our position is, as just opposed to his position, and seeing how we can work things out. Was there another part to that question?
Yes, she has a couple of questions.
Oh, now you have a question. So what's your question?
No, she has several of them.
What's your question?
So the first one is, I think you handled it. She asked, is this the right call from the governor?
Again, I'm not, is this the right call from the governor? I'm not here to criticize the governor. I'm here to work with the governor. We've worked with him in the past on this issue. We've worked well together, and I think you'll hear that from pretty much every mayor in urban centers in Ohio. And because we know what other urban mayors have had to go through with governors who were not as open-minded and having an open ear and things like that. But I will add that having parameters that helps us to make decisions in a more unified way is very helpful. And we are in discussions with the governor about that.
And are there any additional comments that you would like to make related to the coronavirus pandemic, given the fact that Ohio has surpassed over 200,000 cases?
Well, any other comment I want to make about the pandemic, given that the state has exceeded 200,000? No. My statement has been the same ever since, that when the gradual reopening happened, and my position then is the same position I have now, that only works if people follow the basic rules. Stay at home unless you have to go out. If you have to go out, keep social distance, wear a mask, and wash your hands often. And if that happens, then not only do I believe we would not have been in this second spike or third spike, whichever spike we're in, but I do believe we would have a better handle on it statewide. And those are pretty much my position then, is pretty much my position now.
Okay, Mayor, this is the last question that we have. It's from Jason Walker, the media podcaster. What measures will the city take in preventing residential shutoffs of water and other utilities during the increasing COVID level?
Well, the question is, what steps will we take to stop the shut off of water and other utilities during this increase? I think, how many months did we go without doing shutoffs? As a matter of fact, we restored services to people who had not been paying their bills. So we restored services to people who had not been paying their bill, And then there were people who could not pay their bills because of the impact of the virus on their financial situation. That mandate from the state has expired, is already expired. We have sent out, we will be sending out notices to those who are in that situation, who have been either restored or not been paying their bill. And we will be letting them know that we are, that the mandate is over with, and we'll work with them to see how we can get them current in their bill and how we can assist them in whatever way we can to keep them current. I know that the county has put $2 million into a fund that will help with assistance. I don't know if that was, I think it's mainly around water for county residents. And since we control the water system, that would be, we would work with them to help those customers be able to access money like that or other dollars that's available. But let me just say that we restored people who had not been paying their bills, and many of them had not been paying their bills for a long time, but we restored that. I don't know if they'll pay their bills now since they have a history of not paying their bills. But there were those who wound up not being able to pay their bills because of financial situations. And we will work with both of those categories to help them continue to have water or electric service if they're on the Cleveland Public Power, and to help them identify the sources. But the mandate is over, and we will be looking to bring people up to make them current in their bills and to help them going forward.
Mayor, Amanda Van Allen from Channel 5 asked, if the county goes into the purple zone, which we will learn in a few hours, what is the city prepared to do to keep residents safe?
Well, the same question is, the county goes into purple, what does the city plan to do to keep residents safe? I believe I've answered that, but I'll kind of summarize it again. We behave as if we're in purple, meaning that we believe that there's certain things that you have to do, whether you're at level 1, 2, 3, or 4. It doesn't matter. And that we'll continue that message. And that message is around stay at home unless you have to go out, keep social distance if you do have to go out, wear your mask, and wash your hands often. At the same time, we have worked with business establishments as they have decided whether or not they're opening, and we've given them capacity capacity requirements. We've given them mask requirements, operational requirements for their businesses. We have worked with the school district, and the school district was going to go to a hybrid, virtual and in person, but changed that as the number of cases began to go up. So now they're going to be staying virtual for the foreseeable future until there's a better handle on the cases and things like that. So we'll keep doing what we're doing. We'll keep doing what we're doing, and we'll enforce all of the things that we say that we're requiring people to do. We will enforce it. Now, on that, if, however, there are some general guidelines that is presented from the state that wants us to go in certain directions, then we will work with the state and those new guidelines to help us go there. But if you're asking us if we're going to shut down the city right now, I cannot tell you that it's going to be the case.
And last question that we have, Mayor, is from Kathleen Mitchell. When will you allow employees to go to designated locations to investigate businesses in person? Although businesses are repeatedly reported, there are no infractions, even though the websites say that they may be fined for not wearing masks.
Well, the question is, when are we going to have people go in person when there are complaints made? And the implication is that we don't, and that's not so. There are different situations where we are in person. There are other situations where there are calls made, letters sent, and all those, and then the verification to see if in fact the complaint is accurate or not. Many times people cop an attitude and call us about something that's going on that really is not going on. So we try to work through that, but I'll let the Director of Health talk to you about not only our initiative with public safety, but those calls that they get around whether or not they're retail establishments or these big box stores or things like that.
Mayor, just on a point, Monica Robbins from Channel 3 asked a follow-up question on the same point. She wants to know, when you say enforcement measures, specifically what type of enforcement?
Enforcement, and the question is what type of enforcement, from another reporter. Whatever the law says, whatever the restriction says, it's very clear in the ordinance. If you go into a bar, a restaurant, a nightclub, there's a capacity issue. And failure to meet that capacity requirement results in a warning, and then it results in, I think, $1,000 the first time. It gets up to $3,000 a day for every day in violation. It gets up to that amount, and that is enforced. And then we work with, if there's a liquor license involved, then we work with the state liquor board, and their people cite them, and in some cases they suspend their liquor license and their ability to sell liquor. So there is enforcement. But again, I'll let the director talk to you about that.
So as we receive complaints, we investigate them. We do reach out, call the establishment and verify what's going on. Our first response is try to educate them, because a lot of times you just don't know what you're not doing. But then we have to really verify whether or not this complaint is valid. Once we can investigate and determine it's valid, then we can begin to take enforcement actions against those establishments in which we have the authority to enforce. Over the next week, or over this next weekend, we will be out with public safety to again investigate or just visit restaurants, just get an idea of restaurants and bars, and be up throughout the community to see what we can do, how we can better educate the public around the significance in keeping social distance, in keeping your face covering on. In the event we come across establishments that are not in compliance, we will warn them first, and then we will take enforcement actions as called by our authority.
Well, one more question just came in.
One more just popped up.
Lee Chillicum from The Land. The city is planning to hire, this is unrelated to health. The city is planning to hire a consultant to study the future of the West Side market. However, Councilman McCormick stated his unwillingness to support this unless info is provided to the public about the RFP and the state of the market. What is the city's response?
Well, I appreciate everyone else who stayed on topic, but this one is about the West Side market, and we're putting out an RFP to do a study, and they say Councilman McCormick says that he's not going to support it unless the community knows what the RFP is. We have a process, and we engage the councilman. We've talked to the councilman, and we will do an RFP, and we will have that RFP take into consideration not only what the vendors are talking about, what the councilman is talking about, and the things that we've heard back from the public. So we are going to move with an RFP, but believe me, we're not doing this in isolation from the councilman and his input in it. We're not doing that. I appreciate, now, is there any more questions? I'm gonna wait. We're gonna count to 15, and then we're gonna see if there's another question pop up. But I appreciate those of you who ask questions, and I appreciate even more those who ask those questions about this new initiative, not new initiative for us, but this building this institutionalizing this infrastructure to deal with what has now become apparent to everybody, but has been in existence for a long time, but has now become even more apparent to everybody, to institutionalize inequity, disparities, and racism. And our attempt to address this and institutionalize an infrastructure to address it and to do it in a way to help Cleveland become a great city where everyone can share in quality of life and prosperity, and where no one is denied quality of life and prosperity because of their ethnic background, their racial background, or sexual orientation, or whatever it may be. So I want to let you know that this is what we're doing and that we're staying on our game in terms of COVID. And then I know that our communications department has sent out something saying on Monday that many of you are asking questions about the safety on election day. And we'll have public safety here on Monday that will, I think is at 1 o'clock. And they'll go through a press conference and talk to you about those things that we are doing in conjunction with whoever else we're working with on that subject matter. Thank you for listening. See you later.